Did you know that a healthy weight ties to a healthy heart? Well, of course. So everyone knows that being overweight can lead to having high blood pressure, high cholesterol, heart disease. I think everyone probably has somebody in their family that has quote unquote heart problems. So let's talk about why you get heart disease when you're overweight. So when you're overweight, you have this dysregulation of fat tissue and hormones within your body. We call it sick fat. And what that does is it leads to inflammation. When you get inflammation, you have these little fatty acids and these little plaques that build up inside the arteries all over the body. Now you have a smaller area for which the blood passes through the blood vessels. Smaller area means that your blood pressure is now going to go up. You've got constricted areas. So now it's harder for your heart to pump blood throughout the body. So some areas of the body may not be getting as much blood as they need to. Now this can manifest itself in several different ways. Sometimes people can have constricted arteries around the heart, which means that they can have a heart attack or have something called ischemic heart disease where there's not enough oxygen or blood flow getting to the heart. This can manifest itself as stroke. You've got inflammation, you've got plaque buildup, you've got smaller arteries trying to pump blood through to the brain, so we're not getting as much blood flow and oxygen to the brain. The kidneys is another one. If you're not getting as much blood flow to the kidneys, you end up with kidney disease, and sometimes the end result of that can be dialysis. Obesity also leads to something called metabolic syndrome. So, it's really important that we maintain healthy hearts and healthy weights so we can decrease the chances of any of these consequential medical problems from appearing down the line. So the most common heart diseases that we hear about tied to obesity are the ones that I just mentioned, but it can also lead to something called heart failure. So your blood is not going through your arteries as well. Your heart is pumping extra hard to try to get this blood through the body. And then sometimes the heart can just wear out. It just becomes a little bit weak. And then when the heart starts to become weak, sometimes it can start to dilate, which means it's holding all of this extra fluid back and not moving the fluid through your arteries and through your vasculature, is what we call it, properly or efficiently. So sometimes people will start to get some what we call edema or swelling in their lower legs, which is where we normally see it first, because usually you're standing up and it's something called dependent edema from gravity, but also because it's harder for the body to move fluid and to move your blood when you're standing in an upright position. So a lot of times we'll tell people with this type of swelling to elevate your legs. Another thing is people may be getting chest pain, short of breath, something called dyspnea on exertion, where simple things that used to be able to do, like climbing the stairs, is now becoming something that's difficult to do. Sleeping on more pillows at night, we call this nocturnal orthopnea. And then sometimes people are just getting fatigued. Some people really don't know that they've got heart disease until they go to the doctor and they're like, I just haven't really been feeling well. So if you've got risk factors or you've got a strong family history for heart disease, the first step is just becoming aware so that you can do the things that are necessary, watching your meals, watching your movement, medication, taking your medications if you need to, and then making sure that you're eating mindfully, finding the motivation. These are all the first steps that you could do to try to combat some of your risk factors if you know that you're prone to heart disease. At Options Medical Weight Loss, so many of our patients either have a personal or a family history of heart disease. We know that we can help you decrease your weight and decrease your risk factors for heart disease. Please don't hesitate to click the link below to schedule a free consultation. We are here to help you get years back on your life. At Options, we have options for everybody.
Did you like this video? Like, subscribe, and ring that notification bell so you can stay up to date on our latest videos. You can also visit our website using the link below to schedule a free consultation with us. We have options for everybody.